And the Maryland federal delegation with Senator Cardin and the House members has worked very closely together, and we've worked with the governor and the governor's team, as well as with our local officials. So it has been a team effort, and I want to thank everybody on the call for working hard to try to stop the spread of the virus in Maryland. I'm pleased that we're joined today by Dr. Lisa Maragakis, and I'll introduce her more fully in a moment. But here's how we're going to proceed. I'm going to make some brief opening remarks. Then the doctor will make some remarks, and then we look forward to your questions. So Maryland is still very much a hot spot for the coronavirus. As of this morning, we saw 989 new cases, bringing the total to over 25,000. We continue, unfortunately, to see a death toll in Maryland. 30 additional people died in 24 hours, and that brought the total in Maryland to over 1,200 people. So I want to talk a little bit about the federal response on the healthcare front, and then the federal response with respect to the economic impact. On the healthcare front, we've passed a number of bills, 4 bipartisan pieces of legislation, and they include a huge amount of resources to rush to our frontline healthcare workers, our nurses, our doctors, our hospitals, community health centers, senior living facilities, and nursing homes. It's called the Marshall Plan to fight the pandemic. In one piece of legislation, there was $100 billion allocated to it. Most recently, those sums were increased by another $75 billion. We are working hard to try to make sure they get to the places they need to go as fast as possible. Then there's the issue of personal protective equipment, the masks, the gowns, the gloves, and the tests. And in these cases, we don't see a lack of dollars that are causing the shortage. We see a lack of supply nationally and internationally. Not enough of these items are being produced, and of course compensate them for those efforts. But despite our calls for more use of the DPA, we've not seen enough increase in domestic production of PPE, and that's the cause of shortages. We work daily to try to reduce those, but in the long run, we just need a much larger production domestically. And that's going to be especially important on the testing front because as we work to safely reopen Maryland and other states, it's essential that we have those testing supplies. And of course, that includes all the different elements of the tests. Because the last thing we want to see happen is once we get to the downward side of the curve, the virus reignite. We want to make sure that we can tamp it out. I also want to point out, and it's got to be part of our discussion and our response, the disparate health impacts that we're seeing from this coronavirus in Maryland and around the country. It has shown an even brighter light on the healthcare disparities in our healthcare systems, and communities of color have been especially hard hit, particularly the African American community, which is why I organized a letter weeks ago asking the governor of Maryland to release the data based on demographics as well as the racial impact by zip code, and I'm pleased the governor has done that because it helps us not only get a better understanding of the healthcare impacts and disparities, but also helps us direct resources where they're going to be most needed. And when you talk about testing as part of reopening, it's really important that we provide those tests in the areas that are have been hardest hit, so we don't see this resurgence I discussed. So that's the healthcare effort. In order to try to reduce some of the economic pain, we also passed major provisions dealing with workers and small businesses and nonprofits. And I'm just going to list a couple of those, and many of them are familiar to people on this call by now. I would say the biggest part of the economic safety net for workers is the unemployment insurance provisions in the CARES Act. And two major things were done. One, we increased the weekly benefit by $600. So what that means in Maryland, if you go into the unemployment system, you would get what you normally would have gotten, plus an additional $600 a week from the federal government. The other major thing we did was to open up the unemployment insurance system to people who had not previously been eligible. So the self-employed, independent contractors, gig workers, all of those individuals are newly eligible during the period of the pandemic. Now, that being said, we know we've had incredible problems with the state agency that's responsible for administering unemployment insurance in our state. They're having to deal with a huge additional demand, and as many of you may have seen, their website crashed last Friday. They've been working to get it up and running, and we're working with as many people as we can to try to provide assistance. They've received federal funds for the effort. Here is the silver lining, and this doesn't address the real cash flow problem so many people are experiencing. But once you are able to be processed in the system, that $600 payment does get backdated to the time that someone became unemployed as a result of the coronavirus. Another major part of the federal relief was the plan for small businesses and nonprofits called the Paycheck Protection Plan, PPP. Again, that provided relief to many, but as you've seen, it also encountered many problems. Many very large national chains that should never have gotten or didn't need that kind of relief took advantage of the program, while many smaller businesses, at least in the first round, were not able to break through. We made changes to it. In fact, Senator Cardin and I came to the floor of the Senate weeks ago. At the time, the Senate Republican leader, the majority leader, Mitch McConnell, was trying to push through just a straight increase in the amount of funds without any reforms. And we insisted on making reforms. And as part of that, we were able to direct $60 billion of those funds through community lenders. So
I hope y'all
the
can
idea is many
hear.
more mom and pop operations will be eligible. Another program is something called the Emergency Disaster Loan Program, the EIDL program. We also replenished that. Both of these programs have done a lot of good, but they also are imperfect, and we are pushing the Small Business Administration and the Treasury Department to improve them. Some of them need straight-out design changes in order to make them more effective and usable by small businesses. You're aware, I'm sure, of the individual payment provisions, $1,200 a person, $500 a child for those within the eligible income ranges. And then there was a down payment for state and local governments of $150 billion. That really needs to be replenished, and that's one of the major focuses going forward, because we don't want our counties and cities and towns to be unable to pay for emergency responders, firefighters, police, medics, and we need to make sure those funds are much more flexible. There were other programs that were beefed up, including food assistance programs that are absolutely essential at this time. Today, I participated with some others observing social distancing to put together food packs for children over the weekends who are needy. But we need to beef that effort up on the next round. Finally, we provided money to school systems. And in Maryland, our school systems will get a total of $207 million. And I'm really encouraging school systems to use some of those funds to address the digital divide, the homework gap. This is something I've been working on long before the pandemic, but the pandemic has again shown a very harsh light on the inequities in so many of our social structures, including education. Nationally, there are 12 million students who cannot access the internet, either because they don't have a computer or tablet at home, or because they don't have the infrastructure connection, or it's just too expensive for the data plan. And so I introduced a bill some time ago to deal with this, but this has become an even greater and more urgent issue to close what's called the homework gap. And now it's much more than a homework gap, since a lot more than homework learning is being done online. So I wanted to hit on a couple of those major parts of the relief effort. And now I want to turn it over to Dr. Maragakis, who, as you heard earlier, is an associate professor of medicine and epidemiology at Johns Hopkins University School of Medicine, and the senior director of infection prevention, among many other important hats that she wears. So let me turn it over to Dr. Maragakis.
Thank you so much, Senator, and I appreciate the opportunity to be with you on this call today, and I hope I'll be able to provide some helpful information and answer questions. The goal really of our healthcare system in Maryland is to plan and prepare for a surge of patients who are affected by this virus and position ourselves so that we can provide safe care for patients who are affected by COVID-19 alongside patients who have life-threatening, urgent medical conditions that are unrelated to the virus. And meanwhile, keeping all of our employees and our patients safe from contracting the virus. And this is a tall order, but one for which we have been preparing since January, actually, across the state. Hospitals and health systems have been putting plans in place, recognizing that this threat was on the horizon. As the Senator mentioned, we have faced a number of challenges along the way that I think were somewhat surprising, including the supply chain disruptions that have forced some creative solutions to personal protective equipment and to some of our other supplies, really hundreds of supplies that have been put on allocation or in scarce supply during our response. Nonetheless, I think that we have so far been quite successful as a state due to the social distancing and the policies and procedures that have been put into place with the goal of flattening the curve. And although our numbers are quite high and we have all had an influx of patients with COVID-19, we are so far achieving a fairly flattened curve, I would say. We've seen increases in recent days, but are holding steady with occupancy that is essentially half hospital filled with patients who have COVID-19 and the other half who have other life-threatening conditions. This has been a process really of transitioning and reallocating our hospital beds and our resources from non-COVID illnesses to the care of patients with the novel coronavirus, and then in many cases needing to actually increase capacity, particularly for ICU care. Early on, there was a great deal of concern about the number of patients that would need intensive care services and particularly mechanical ventilator support. And thankfully in our state, we have been able to fairly easily manage the number of patients needing mechanical ventilation in terms of having enough ventilators. And one of the limiting factors has been our staffing models. And so a lot of work has gone on over the past weeks and months doing redeployment of staff from their usual jobs in healthcare, in some cases doing skills training and redeploying individuals from their usual jobs to respiratory therapy and intensive care unit posts in order to increase this capacity and make sure that we are ready for what comes. On the medical front, I would say that, as we all know, there are currently no vaccines or proven therapies. However, we do have a lot of experience with supportive care for patients with life-threatening viral illnesses such as this one, and a number of clinical trials are ongoing with candidate drugs. And you may have heard that preliminary results were quite promising for one of these, called remdesivir. And at Johns Hopkins Medicine, we are one of the sites in this multi-center clinical trial that compared remdesivir to placebo. And the interim analysis showed promising results that caused the trial to end because the patient's time to recovery was significantly shortened when they were treated with remdesivir, and the median time to recovery was 11 days for those treated with the drug, compared to 15 days for those who received placebo. And so that drug has now been approved by the FDA and is available to patients in the trial, and will also be considered standard of care for seriously ill patients suffering from COVID-19 going forward. There are a number of other candidate drugs that are in clinical trials, including other antiviral agents that help block the attachment of the virus to its receptors in the lungs, as well as broader strategies called immune modulation strategies, such as IL-6 or some of the cytokines that can lead the immune system response to actually cause harm. And there are a number of candidate drugs that can try to control that reaction and thereby help patients recover. And there are ongoing attempts at vaccine development, and I'm aware of at least 5 that are in the pipeline and in trials right now. And a great deal of effort has been put into developing these as quickly as possible because of the urgency of the situation, some of the safety testing and the efficacy testing, as well as the preparation for production of the vaccine itself, are being compressed into concurrent activities in hopes that one of these candidate vaccines will show promise and be able to be brought to market in record time. So those are ongoing. I do have to inject a note of caution because of what I just said. You can imagine that the concurrent nature of pushing the timeline for a vaccine development does bring with it some safety concerns, and that will be something to watch going forward. Just recognizing that we will have to keep a close eye for any unintended consequences, as we know can happen sometimes with vaccines, such as providing not complete immunity, and in some cases even kind of priming the immune system to be more responsive to the virus rather than being completely protective. So I know that a lot of experts are working furiously trying to develop a vaccine, and hopefully we will have news about that in coming months. In the meantime, the main components of infection prevention, as I mentioned in my earlier comment about flattening the curve, is really everything that has been done for social distancing. And I can't emphasize that enough, because really in this time period where we are trying to develop vaccines and discover effective therapies, we are left with the very basics of infection prevention, and that is hand hygiene and social distancing. And I believe that these techniques and strategies are going to need to be with us for the foreseeable future, looking at models that show that we anticipate the virus will remain with us, and that as we take cautious steps towards reopening or resuming normal activities, we will have to use testing, our testing capacity, and our data to really guide those steps and maintain our caution and our social distancing to some degree, so that we can ensure that viral eruptions or rekindling of transmission does not occur. So with that, I think I'll conclude, and maybe we can find out what is on your minds and answer your questions. Senator?
All right, so now we'll go to some questions. As a reminder, if you have a question, please just press *3 at any time. That's *3. Our first question is going to be from Michael from Leonardtown. Michael, are you there?
Yes.
Go ahead.
Hello.
Hi,
Senator,
you're on.
Yes, hello. Thank you for having me at Town Hall, Senator. I'm a small business owner, and I applied for the payroll protection plan back on April 3rd. And the first round, as you mentioned, was exhausted pretty quickly with abuses from large companies. And, I also read banks favored some of those larger loans, et cetera. So the first part of my question is, will those banks and large companies be held accountable at some point and asked, or not even asked, but demanded to have that money returned, so that actual small businesses that the money was intended for can get that money? I have not received the payroll protection plan, and I have a fitness business which is going on the second month, coming up on 2 months now, being closed. So there's not much margin left if we don't get aid. So I'm wondering if there's any additional funding plan beyond this second round that will reach out to other small business owners, because I'm sure I'm not alone, and probably being on the brink of having to go out of business if we don't get some kind of aid and not be allowed to reopen soon.
Yeah, thank you for that question. And as you indicated, and I mentioned in my remarks, there have been lots of issues with the Paycheck Protection Program. I'm not going to go into any detail here, but I put forward a very different proposal during the debate on the CARES Act that I thought would be much more flexible and also had much more funding up front, so that we wouldn't run out so quickly. But with respect to the PPP program, the changes that were made in round 2 have increased the amount of funds that are flowing to smaller businesses like yours. But it is still true that there are many that are still waiting in line and have not accessed their funds. We are going to work to hold accountable those that abuse the system. In addition, originally banks were imposing conditions on applicants that were not part of the law. They were essentially saying that unless you had a pre-existing lending relationship with them, that they would not take your application. That has been changed, and now that we have $60 billion flowing down through community banks and other lenders, that is intended to try to make sure more money gets where it should, like your small business. Now, in terms of next steps, my view is yes, we're going to need to provide additional funds, and I'm going to be looking for ways to target those funds to even smaller businesses. In other words, having the funds go through community lenders is one way to try to do that, but you can do it more directly by making it clear, by the size of the business, both in terms of employees or revenues or some other proxy, that we really want this to go to small businesses like yours. I will also point out that there are some serious design flaws with respect to the 60 days of the money for the PPP, because it really needs to be much better aligned with the time that the business expects to see customers coming back in the door, because otherwise you create this really ridiculous incentive for some small employers, say a restaurant, who had to let their employees go early on, then they hire them back for 60 days to get the loan forgiveness, and then they have to let them go again. So we need to change that. I've been working to change that. There's an artificial 25% cap on fixed costs like rent and mortgages. I've been on the phone directly with the Secretary of Treasury, Mnuchin. They imposed that condition through regulations. It was not in the bill. That needs to be changed. So going forward, we need to both put more money in this program. We need to make sure it's directed even more toward small businesses, and we need to make some design changes to make it more effective. Let me also just give you an email, and this goes for others on the line. We can try to be helpful, at least in trying to figure out what the status of someone's application is. If you go to assistance@vanhollen.senate.gov, assistance@vanhollen.senate.gov, we will try to be of assistance to you as your loan application is processed. There are other issues regarding making sure that people understand the forgiveness requirements, and they've not issued very clear guidance. I'm pushing the Small Business Administration to do that as well. Number of stories of people who got the loans, good small businesses that should, but are confused about what they need to do in order to get the forgiveness and don't want to be stuck with a big debt at the end of the period. And so we're pushing hard for clarification there. Lots of other issues related to this, but let me just leave it with that email address where we can try to be helpful.
All right, next we'll go to a question from Marie from Annapolis. Marie, are you there?
Yes, I am.
Go ahead.
Senator Van Hollen, I worked for District 18 back at the time that you served in the state legislature. And my question has to do with testing and lag time. I'm an 80-year-old senior with underlying conditions. I was referred for a test to the health department by my doctor on Friday. I was supposed to be contacted back and given a number to call for an appointment, and I still haven't heard. I realize those tests that Governor Hogan ordered are incomplete, and I wondered if there are any updates on whether or not those tests can be used soon, or we will have a faster chance to get testing in the drive-in places.
Well, thanks for that question and raising those important issues. And I'm going to talk about it, and maybe the doctor wants to talk about it briefly too. But I think what people have discovered is that when someone says that there are tests available, sometimes they're referring just to one part of a test. But in fact, in order for a test to be useful, you need all the different elements, all the different legs of the stool. And if you don't have them in equal numbers, then you don't have the tests that you need. So you could have 500,000 of one element of a test, but if you don't have 500,000 of all the different legs of the stool, you can't use them, at least not quickly. And for testing, there are all the elements from taking the specimen, so that requires a swab, to the transport kits, getting that specimen to the lab, And then at the lab, they have to have the testing capacity, and that includes the reagents that are necessary to complete the test. And if you don't have adequate numbers of all those different legs of the stool, you're not able to ramp up testing, which is why the reality is that the state is still way behind when it comes to the ability to quickly conduct testing, including, very importantly, the community-based testing that you're talking about. Right now, the tests are being deployed to nursing homes, and that's important. They should be. They need them. Some tests have been deployed to some of the poultry farms on the Eastern Shore because the outbreak there, that's good. But we also need many more tests for people like you who meet all the protocols, and your doctor has said that you need to get a test. And this is why we've been pushing at the national level to dramatically increase American production of all these different elements, of the swabs, of the transport kits, of the reagents. Because if we don't have all of those in high numbers, we're not going to have the kind of testing we want. And right now, the experts tell us we're at least at only 1/3 of the tests that we need to do to reopen. That we're at about 150,000, but we need to get to triple that number per day. And in fact, many experts say it's almost 30 times that number per day to truly reopen safely and monitor this so that it doesn't reignite, as the doctor and I were talking about earlier. So we're going to keep pushing for more of those tests to be up and running, but you're right. I think expectations were raised quite high when people saw that Maryland had 500,000 tests, but in reality, we don't have all the elements of those tests and those numbers. So we're going to keep pushing. Again, if we can be at all helpful in trying to connect you with the test, you can also use that email. Doctor, I don't know if you have any comments on this part of the question of the supply chain for tests.
Well, I think you covered it very well, Senator, and it does continue to be an issue, although I do feel like it is improving somewhat, and we have a number of different platforms that our hospital labs and the state labs are using in order to provide testing as broadly as possible. In addition, there are studies underway trying to improve the ease with which we can take a sample from a patient. Right now, the swab needs to be passed through the nose into the back of the throat. We are certainly hoping and looking at ways that we might be able to test from the nose itself without going so far back into the throat, or maybe even developing tests that can test for the virus in saliva from the mouth, so that those would be less invasive tests. And then I would mention a public-private partnership between Johns Hopkins Medicine, the University of Maryland, Care First, and the City of Baltimore and the state that I think is really trying to do a lot of what we're describing this evening in terms of setting up testing sites in different communities. But the limitation is still there about the testing reagents themselves.
Thank you.
All right, next we'll go to a question from Steve from Tacoma Park. Steve, are you there?
Yep, I'm here.
Go ahead.
Thank you again, Senator, for holding this. My question is really a suggestion for you. As you referred to before, a lot of people are having difficulties surmounting the inherent problems with applying for unemployment benefits. A suggestion would be to, in stimulus funding, provide for the funding for hiring navigators to assist people. That was used in the initial rollout of Obamacare, and as I recall, it succeeded fairly well. It would also could be done at a safe distance, and it would provide some employment for people who need it.
Well, thank you for that suggestion, and I will say in this case, the piece of legislation we passed, the CARES Act, does provide substantial additional funds to the state unemployment agencies to help them implement these plans. And Maryland has received both rounds of the assistance. This is actually one area where the federal agencies released the monies very quickly, including $16.8 million that's come to the state of Maryland that they can use in a flexible manner to do exactly the kinds of things that you're talking about. We've been on the phone with them repeatedly. I talked to Secretary Robinson, the State Department of Labor, weeks ago. Our congressional delegation had a follow-up call with her. Again, the federal resources have been made available. The issue has been that the state system, needed substantial changes, and I guess the vendor that the state brought in was not able to deal with the demands of the system. So we are very frustrated with this situation. What we're doing is trying to help people, reconnect with the system. And we have provided, what is frustrating is we have provided those additional federal funds to help with the navigators and that kind of idea. So thank you for raising it. We're going to continue to pursue this issue. It is creating an unnecessary amount of hardship as people have to wait even as their bills pile up. Again, this doesn't compensate for the cash flow problem. But I do want to emphasize that when you do get through and you get your claim processed, the $600 per week will be backdated to the time the original claim was made when you were originally eligible for it. Again, it doesn't deal with the cash flow issues, but it does mean that people will ultimately, when processed, get the full amount under that provision.
All right, next we'll take a question from Charlene from Baltimore. Charlene, are you there?
Yes, I am. Thank you. Okay. This question is for the doctor. I am 66. I will be this year. And I want to know why I keep hearing that individuals 65 or older are considered to be vulnerable. I don't understand what that means and why is age a factor. Because I consider myself pretty healthy, try to eat right, don't smoke, don't drink, all those kind of things. But I know people that are younger than me that does all that. So why aren't they considered more vulnerable than me? And why age is always mentioned as for people that are considered vulnerable. So please explain that to me because I never understand that. And I have another one, please. And I wanted to know why is a certain area considered hit more with the virus than any other area? Is it because of lack of social distancing? And the response to the last caller said something about unemployment, and the senator was responding. My question is, why don't they have more customer service representatives to answer questions? Because when the system freezes up and you can't put your information in, you get frustrated because you don't know if anyone is looking at all the information and documents you're submitting so that when the money comes out, you're getting what you deserve or what you're supposed to get. No one's responding, no one's contacting, no one's reaching out. Not that the administrators and those who implemented the system and you, Senator, are frustrated. Look at the people who are sitting here just waiting to provide for their family. And the credit bureau is not nice to people when they're not paying their bills. Something's got to be done. And
Doctor, do you want to take the first part?
Sure. Thank you, Charlene, for your questions. I will start with the first one that you had, which was about age. And what we know about age, unfortunately, is that our immune system, as we age, gets less efficient at fighting all kinds of infections. Now, that's a general statement, and of course, there is individual variation, and it sounds like from your description that you are leading a very healthy lifestyle, and all of those actions that you have taken help protect you from all kinds of bad health outcomes, including infections. So it's not a one-size-fits-all situation. However, what we do know is that people of all ages are susceptible to catching this virus. So it's not that age makes you more likely to catch it. It's that once an individual gets the virus, catches it from someone, then in general, older individuals are at higher risk of having complications and a severe case that might need to go into the hospital, might need to go into the intensive care unit. So it's a general statistic that applies across the board, but again, there's individual variation. And as you said, if you have a healthy lifestyle and do not have underlying health conditions, then actually a younger person who has those other risk factors could be at higher risk of severe complications than you are from age alone. You asked a question about why different areas of our state or a city might be hit harder by the virus. And you mentioned social distancing, and I think that is a primary driver because we know that respiratory viruses are spread person to person. And so, unfortunately, in different areas of our city or our state, there are different conditions. People are packed more densely into certain areas than they are in other areas. Some vulnerable populations have more people living in a household where it's harder to have social distancing. People who need to go to work at jobs because of their essential role may have varying degrees of social distancing in that job setting. So I think that you hit on the primary driver why we know that the virus does strike certain areas harder than others. But we all, as I said, are vulnerable to catching it. So it's an equal opportunity pathogen in that regard.
Next, we'll go to a question from Robin from Westminster. Robin, are you there?
I'm right here.
Go ahead.
Thank you. Okay, first of all, thanks a million for having this forum for us. And I'd like to say I'm a former Cecil County resident, but now I live in Westminster and Carroll County, and I'm a former Maryland State teacher, both in Baltimore County and Queen Anne's County. And my question is dealing with how are you allocating the funds for education and food? Because I know there's a big, big need as you funded a lot of the monies around the state. But what are you using to allocate? What data, I guess I should ask, as far as allocation for the education needs and the food needs?
So thank you, and thank you for your teaching service. So let me take those in pieces, the education money and then the food assistance money. In terms of the education monies, they are going to every single one of the 24 LEAs in Maryland, so every county school system plus Baltimore City school system. They're allocated according to the Title I formula so that those schools that have the greatest needs get an extra share to help them through this difficult time. The funds can be used, though, in very flexible ways. But the allocation to each school system is based on Title I, but then those monies can be used by each school system to meet the particular needs that they have. And of course, one of those needs right now, as I mentioned, is the issue of distance learning and closing the digital divide and the homework gap. And I have talked to every one of the 24 school superintendents and encouraged them to use some of those funds for that purpose. Now, there's also a $46 million education fund under the control now of the state, under the governor's control. We're also urging the governor to use those funds to help address the homework gap. Those funds in the governor's office can be used for K through 12, but also for colleges, both community colleges and four-year colleges. Now, on the food front, the main thing we did in connection with students is to beef up the school lunch program. Now, obviously, students are not getting those meals while they're in school during the day, but 350 Maryland schools have been designated as food pickup sites. And right now, students and their families are going to pick up food at those sites during the week. In addition to plussing up the school lunch program, we also provided additional funds for something called the Temporary Emergency Food Assistance Program. That's the program that helps supply food banks in our state and other states. We also increased the SNAP program. And just in terms of the temporary food assistance program through food banks, for example, today I was at an organization, a great volunteer organization called the Baltimore Hunger Project that helps provide food to students on weekends. Since the student lunch program foods that people pick up at schools, that quantity of food is for the week, but that leaves the weekend. And so we were there putting together essentially, food baskets for students to take home this weekend. This is another area where the funding is also going to need to be replenished because I think all of us have seen the long lines of people waiting to get food, people who never expected to be food insecure. That problem is made worse, of course, by the fact that the unemployment compensation, the unemployment insurance monies are taking so long to get out the door. So people are really strapped for cash, which increases the need for emergency food relief. But we are providing both our schools with the funds for education purposes, as well as the funds I mentioned for food assistance. Thanks again for your service as a teacher. And we're going to need to make sure that students have a chance to catch up. I mean, a lot of them, of course, are losing valuable time, and there's talk about volunteer summer school programs and that kind of thing, and this funding will be badly needed for that.
All right, and next we'll go to a question from Elizabeth from Crofton. Elizabeth, are you there?
I am.
Go ahead.
I just want to emphasize the importance of funding the U.S. Post Office system and keeping the U.S. Post Office system active, so when we go to vote in November, we don't have to actually go to the polls, that we have mail-in voting, not just in Maryland, but across the United States. Thank you for taking my question.
Well, thanks for making that point. And first, just on the U.S. Post Office, this is the one agency that provides universal service for postal delivery. And, there are obviously other companies involved, but they don't provide service everywhere, and they don't provide it at the kind of costs, the lower costs that the Postal Service can do it. which is why we need to make sure the post office has the funds that it needs. They're the one entity in government that has this unfunded health insurance plan that the federal government has not been helpful in addressing, and we need to do that. Other federal agencies have those costs covered. We need to do it for the post office, and this assistance has got to be part of the next round, because the post office, of course, has seen a big reduction in mail, primarily because advertisers, which represent a fair amount of their business, are not, sending out advertisements because there's not that many customers to buy some certain products at this particular time. So we need to make sure that we address the post office. Now, we did in the earlier bill, one of these, the CARES Act, we provided a $10 billion lending facility to the United States Post Office to help them during this period. But the president, you may have seen, has decided to try to impose conditions on that money that are totally outside the bounds of the bill. The bill didn't apply any conditions to those loans, and the president has made up different stories about how certain companies are disproportionately benefited from the post office, which have all been debunked
get his
by
out of
the
there.
analysts,
He got
neutral
to go.
analysts who've looked at this. So we need to do that, and we need to do it for the reason you say, because during this period of coronavirus, we need to plan on people being able to vote safely, and that means including an option, a real viable option to vote by mail. Now, we provided some funds, $400 million in the CARES Act to help state, election systems move in this direction, but that is not enough. We need substantially more funds. We're pushing for another $1.6 billion. That's the number that we think is necessary to help with these conversions. And we need people to be able to vote safely by mail. Every state should have an early vote option. We should also have, a vote by mail option. There should also be safe early vote options and safe same-day voting options. But this is going to be a big part of the discussion on the next round of legislation. So thank you for raising it.
Next, we'll go to a question from David from Greenbelt. David, are you there?
Yes, I am.
Go ahead.
Okay. Thank you, Senator, for the assurance about the Postal Service. I can't support you more on that. But I have mainly a question for the doctor, and this is on social distancing. Having a number of risk factors, I'm particularly concerned about the fact that the recommendation on somebody who's not masked is 6 feet a reasonable distance if you're at high risk, or should it be some other kind of number? What can you tell us, doctor?
Thank you, David. That's a great question. So the 6-foot recommendation really comes from the fact that most respiratory viruses are transmitted by larger droplets that are expelled when someone coughs or sneezes, can also be present when someone's talking or singing, and most of those are large enough that they're going to fall to surfaces or the ground within 6 feet. Although you may have seen photographs and film that show that under certain circumstances they can actually travel further. A very powerful sneeze, for instance, or cough. So there's no magic number for the distance. I think 6 feet is really, as I said, from the data around most of those droplets. The process of masking is really just a physical barrier to try to catch some of that so that it's less likely to get from one person to the other. So the combination of the 6 feet and the mask together really help protect you, whether you have risk factors or not. It helps protect each of us. When someone is not masked, early on in this pandemic, we did not have a universal masking rule, and the 6 feet is still helpful, although I would say that the mask adds an additional, a physical barrier there. So I would want to have both, and I think that's why the guidelines and policies in public places are now calling for that. And I would stay, personally, further away from somebody who did not have a mask on. How far? It's hard to say. And then there is a question about whether this particular virus can actually remain aloft for a longer period of time. So in the healthcare setting, we are using environmental controls like negative pressure and respirators when we are caring for patients who are ill with the disease, recognizing that we often are doing what are called aerosol generating procedures, that giving nebulizers or putting a patient on a mechanical ventilator can actually, we believe, cause smaller droplets that can remain aloft in the air. And so I have seen reports, for instance, of transmission of the virus when large groups got together to sing, for instance. And so you can imagine that if somebody is coughing, sneezing, and or forcefully expelling air through singing or other activities, blowing out candles on a birthday cake, etc., you don't want to be across from that person. So I hope that helps kind of explain why we do both the social distancing and the masking.
All right, now we're going to take a question from Amy Singer. This question comes from online. Amy asks, how can national service be utilized to help the state, and how can AmeriCorps be extended to meet the state's needs?
So, Amy, thank you for that question, and we are looking at exactly this idea as part of the next round of legislation. In fact, we've, as you've probably seen, the Senate has not been in session until today. We just had our first vote in a while, and so we have not been able to introduce the new bills, but I will this week, along with Senator Markey and others, be introducing a bill to essentially hire more, bring on more volunteers in AmeriCorps, make sure they also reach out to the over 7,000 Peace Corps volunteers who we had to evacuate from countries overseas, and also beef up FEMA, but look at AmeriCorps as sort of the unit of agency that we can really put people to work fighting the coronavirus, especially as we have to expand the testing regime, because the testing regime will require community testing. We need, as to safely reopen and to monitor this over time, to do more of what's called surveillance testing, meaning testing people who are not symptomatic. This is, of course, a disease we've discovered where a lot of people carry it, even though they're not exhibiting symptoms. And so if we want to make sure we reopen safely, we have to have this much higher level of testing in order to monitor any outbreaks. As somebody said, and the doctor has said, if you have an outbreak, you want it to be a campfire, not a bonfire. In order to make sure that happens, you have to be able to identify people quickly and isolate them, and do the tracing, the tracking down of all the people that person's been in contact with. And that requires a lot of people power. And AmeriCorps would be an organization whose mission very well fits exactly that sort of national health mission that will be required going forward. And so we're going to be introducing that legislation. There are others that are working on similar bills, and we look forward to combining them. So thank you for raising that. It will be another one of those things that we hope to include in the next round.
All right, and we've got time for one last question. We'll go to Ellen from Baltimore. Ellen, are you there?
Yes, my question to the senator is, I'm a senior, and I've been a senior since about 2007, and I've been getting my Social Security as far as direct deposit. This is about the stimulus check. What I don't, to my understanding, when I heard it first from the treasurer on TV, he said that if you already a direct deposit person as far as Social Security, you would get it through your direct deposit. But my thing is, it's a lot of people are going on to the IRS, and then whatever they're doing with putting their information in the IRS. But some of the seniors in my building are getting it, but some of the seniors in my building are not getting it. So my question is, are we supposed to go into the IRS and put our information in, or is it automatically going through the Social Security? That's my question.
Okay. Well, thank you for raising the issues about the individual payments, because there has been a lot of confusion about that, and they are going out at very different rates. So this is the way it's working. As far as I understand it, I've been trying to monitor it carefully. If you filed your taxes in 2018 or 2019, electronically especially, then you will have received or should soon receive your individual payment checks electronically. If you filed for your taxes but did it non-electronically, then you would get it by mail, again automatically by mail. I will say you probably saw the reports that they wanted the paper checks. Apparently, the Secretary of Treasury wanted the President's name on it, or the President wanted his name on it. There's some indication that slowed it down. But in any event, those paper checks will also come to people who have filed their taxes in 2018 and 2019, and they don't have to apply for them. Then it's also true that individuals on Social Security who did not file taxes will also get the checks, and they don't have to apply for them. You don't have to apply for them. One of the changes we made to the original proposal was to ensure that Social Security recipients would get these payments sent to them. Now, they are slower than the electronic payments, and they may be slower than some of the other payments that are going out, but they should be automatic when they come. If you don't have direct deposit set up, that's when you would want to go to be put on IRS.gov. In other words, if you wanted to receive your payment through direct deposit. So that may explain why some have gotten it that way and some have not. But again, you don't have to contact the IRS to ultimately get that payment. Now, the payments are also going to individuals on SSI and those who have VA benefits. And again, they do not have to apply. However, there's a wrinkle here, and I want to mention this right now because we have a deadline coming up tomorrow. If you're on SSI or you're a VA recipient, you do need to file by tomorrow to receive the $500 extra per child. And we're trying to extend that deadline, but that is the deadline that the IRS has set. And to do that, to make sure that you enter your dependent information, you should go to irs.gov/coronavirus/non-filers. You're a non-filer because you haven't filed income tax return and need to enter the information about your dependents. Finally, there are a whole category of other people who are not getting the check sent automatically, either through direct deposit, electronic deposit, or by mail. Those include people who are not tax filers, people who are working but did not file an earned income tax credit. In many cases, very low income individuals. They're also eligible, but they do need to file. They need to proactively file for this payment in order to receive it for themselves and or for their dependents. So again, that was a long answer, but there are many pieces to it, and I'm glad you asked it because I think a lot of people are also asking the same question. So I'm getting the signal here that I have to wrap up. I want to thank all of you very much for joining us for this call. We will be doing future teletown hall meetings. It's a good way for me to try to get you the most up-to-date information on what we're doing at the federal level, as well as hear your questions and input. I also, again, want to thank Dr. Maragakis for joining us because having her expertise is invaluable to us and to you who have questions on the healthcare front. So again, let me thank all of you for what you're doing to help us get over the top of this and bend the curve through your social distancing efforts. And again, I just want to say that you can reach my office for assistance through that email I gave you, assistance@vanhollen.senate.gov, or you can reach us through the phone number that went out at the time of the telephone town hall information, 301-545-1500, 301-545-1500. Again, thank all of you for joining us. I'm sorry we couldn't get to all the questions. I hope we got to a representative number of questions. We are working hard with the state agencies on UI. I understand how frustrated everybody is. We have been trying to knock down their doors as well, provided them with more assistance to do things like get the navigators. And on the small business piece, we're going to work on trying to improve it even more so that the mom and pop operations, the small businesses that really need this assistance the most, can get it in time. And I know time is running out. Thank you all very much. And we will do this again. And we're signing off now. Take care, everybody. Have a good evening.
Okay. That was that.
The Access Live event has ended.
Thank you for participating in our telephone town hall event. If you would like to leave a question or comment, please do so after the tone. Thanks.
If you wish to leave a message, please press 1. Otherwise, you may simply hang up.
About the non-fathers and the